Hello, my name is Teresa Curio. I'm going to be talking about the ethical issues and research surrounding communication. Scientific communication involves scientific research and evidence-based practice in healthcare. The principles of scientific communication include clarity, accuracy, simplicity, and understandability. It is important to write clearly, have data accurate, and easily access reports of medical studies. Healthcare research requires human studies that have ethical implications. These ethical implications include beneficence, non-maleficence, autonomy, informed consent, and patient privacy. Beneficence is the act of doing good to benefit the patient. Non-maleficence is doing no harm, which means taking the preventive steps onto avoiding harm with effective communication. Informed consent is where patients are informed on the risks and benefits prior to consenting to the procedure, which is closely related to autonomy. Autonomy is where patients have the necessary information to make their healthcare decisions based on their own needs. Lastly, patient privacy is where the patient information is kept confidential. In regards to the ethical implications, there is an offer of full disclosure of being clear when researching and considering the risks and benefits when explaining to the participants. In order to effectively communicate to patients, families, and healthcare providers, I would have to understand my audience by doing my own research on who my audience is, what their demographics are, what language they speak, and what resonates with them the most. For example, if a patient speaks another language, I would have to find a professional translator. Also, I would have to see what resonates with the patient. I know for me, I'm a visual audio learner, so I have to see things first in order to picture them in my head when I hear them. And there are times where we need to express ourselves through writing. So in order for it to be effective, I would have to reach my audience and explain the scientific communication. Some things to consider when writing is to write in active language rather than passive. This makes it more clear and easier to understand. The more filler words we use can confuse our audience, so it's better to keep it clear and concise. One thing I like to do is proofread when I'm done. Unlike verbal communication, non-verbal communication is also important because we should keep in mind to keep eye contact and actively listen to our patients in order for effective communication. Thank you for watching this video.